I'm Rajesh Singh and I'm Chief Executive Officer of Wish Foundation, India. We have seen it, we have experienced it, that a stronger primary healthcare services can really help us, not only during the COVID or COVID-like diseases, but in general situation also. And why? Because there are data which shows that 80 to 90% of the cases or human health needs can be really tackled at the primary health care. So if we really strengthen it, I think we will be able to really meet the unmet need of healthcare within the larger, Indian setting there. The role of non-government organization is paramount into this. Initially, the non-government institutions were reluctant, hesitant, because there were lack of opportunity for them to play a key and critical role. But over a period of time, we have seen that the non-government agencies really started managing the primary health centers in a public-private partnership mode there. There was opportunity for them to really take over the whole functioning of the primary health care centers and convert and make it really a model primary health care center. So that's A. B, lot of non-profit, they really have a digital health and medtech bent, and they use these two to really provide the quality health care services and also improve the data, which is really essential to see how the primary health care centers and services are functioning, and also whether it's really creating an impact on human lives. I think the third role that the non-profit and non-government agencies can really play, that even though the health is the government subject, but the government also need the support of primary health care services or agencies which provide primary health care support to the states. Both at the national and state level we have seen, including WISH, which runs the technical support agencies to really provide support of respective states in strengthening the primary health care response, that when it's a well received response and the input is quality, the state also get benefited, and in turn the quality of the services get improved and the last mile finally get the quality services, which is the need of the hour. The government of India is really on a massive journey on transforming the almost 155,000 primary health centers across the nation, and if that happens by the next year or so, we will be able to really move forward and take a giant leap towards the universal health coverage there. The Ayushman Bharat Digital Health Mission, which was launched on 15th August 2021 by Honorable Prime Minister, that really brought the digital health into the focus of all the healthcare delivery system, be it National Health Authority, be it National Health Mission, be it at the national level, be it at the state level. People have started accepting it as a medium to really improve the healthcare delivery system, improve the data, use these technologies and tools such as AI and ML to really improve the performance of the delivery, which is healthcare delivery system, timely and appropriate decision making, so that the input can be provided and action can be taken by the concerned authorities on time, real time, and also improving the total overall quality of the functioning of the primary health, which will actually assist us in meeting the universal health coverage deadline and timeline by the country. 80% of WISH program is focused on rural last mile population. In fact, the whole philosophy of WISH is to transform the primary healthcare through innovation, and if you really see these, both primary healthcare and innovation, which is technologies, medtech, process innovation, is helping the last mile reaching their or fulfilling their unmet need. And keeping that philosophy in mind, since the beginning of its inception, which is 2014-2015, which has been running majorly the programs in the rural areas. And rural areas can be defined in multiple ways, but our focus has been the areas which are far flung, where the core and key indicators, health indicators are very low, and which aligns with the national and state priorities also. So, even districts, the geography, the blocks are being selected keeping the low performing facilities and also access and availability of services for the last mile population. So, keeping the accessibility, the availability and the affordability in mind, which we call 3 A's, which always prioritizes before developing any strategies for the state as well as intervention as well as scale.